Cool.
Okay, I would like to call to order the Public Health and Community Service Committee meeting on February 2nd at 8:33. Can I get a roll call, please?
Eric Hendricks. Lou Ness.
Here.
Mike Shorten.
Here.
Gloria Van Hoff.
Here.
Kelly Wegner.
Here.
Pamela Altoff.
Here.
Tracy Von Bergen.
Here. Okay, next on the agenda are meeting minutes approval for Public Health and Community Service Committee meeting, January 5th, 2023. Can I get a motion to approve the minutes as presented? Member
Wagner.
Member Wegner, second. Member Shorten. Are there any amendments or revisions? Okay, seeing none, all those in favor say aye.
Aye.
All those against say nay, motion carries. The next item on the agenda is public comment.
We have none, Madam Chair.
All right. So then we will move on to member comments.
I just quickly, so a week ago now, I went to the Network Council, which is a group of a bunch of nonprofits and service organizations here in the county. And because I was there, I was honored that they went around and introduced themselves and told me the barriers that they had for services. And just, I know everybody knows this, but just so I can restate what they were stating, it was transportation, staffing, and housing. So every single one of them said transportation, and the others said those three too. So I just wanted everybody to know that the nonprofits are struggling with those three things.
Thank you. Member Altoff.
Just in response to that, let me throw out an idea. And I know that, many of us who have been around a long time know kind of the sequence of events that have occurred and how the county has dealt with some of those same challenges. Maybe what we should consider doing at some particular point is inviting those entities that provide some of the services and have them come to this committee and just present what they've done in the past and what they're looking at now and some of their limitations, so that we have a broad perspective of exactly what those challenges are and how we've attempted to address them, and maybe what we need to look at moving forward to assist them. So I would just say, maybe if we talk to McDOT and invited PACE and some of the other entities, we could at least get a historical perspective, which will give us a better idea of how to move forward.
I agree. Those topics were discussed a little bit in transportation yesterday, and
Yeah.
and they're on top of it, but I think there's definitely some communication that.
But there is a
we need to
definitive
put out. Yes.
And I did
exactly.
suggest to them to start coming to meetings, whether it's our meeting or transportation or the public health board, that they should start talking.
Excellent.
I do want to say, I know I feel like the old person on this board. You're probably tired of hearing me say this, but transportation was a huge issue 30 years ago.
Right.
And it's, we talk about it and then we drop it. Then we move on. Then we talk about it, then we bring it up. And so it's, I think the message to transportation is, could we really do something, especially in the 2050 plan, looking at how we do that. So just surprising to me that we're still, I'll be dead and we'll probably still be talking about it, so.
Well, don't die.
Yeah, right.
Yes, I was very happy to attend a meeting with Leo and Connie at the Mental Health Board this past Friday. We had a wonderful meeting, and probably would have stayed longer if the time hadn't gotten away from us, but was able to get a good perspective of what some of their issues are, and we didn't go into a lot of details since they are going to be presenting here today, but I want to thank them both for having me there and getting me more familiar with what to do.
Okay, great. Thank you, everyone. So we'll move on to reports. Don't see any reports on here. How about some new business? Doesn't really look like there's any new business.
Where do we do this?
I think we'll look at that under future.
Okay, great.
Topics.
Okay, thanks.
Okay, routine consent agenda. So we have one item. Does anybody want to pull that for discussion? Member
I'll just make a
Wagner?
motion to.
I'll second.
Okay, second by Member Altoff. Do we want to have Hans come up and do a brief synopsis of, I think we probably should, to get everybody on the same page.
Good morning.
Good morning.
For the record, Hans Mock, Community Development Administrator, and what you have before you today is rescinding a contract that we have with an individual who provides homeless management information services, database management, as well as other duties. We went through the procurement process in early spring, late winter of last year, and secured that contract with that individual. It was subsequently determined that the contract should be converted over to becoming a temporary employee until I think it's April of 2025. So that would be what we would do, because we would add a temporary staff person, level 8E, community development specialist, to our roster.
So can you kind of give an overview of what that position does?
Yes, sure. In this particular case, it's more of a planner. So this individual will be doing our consolidated plan for the next 5 years, 2025 through 2029. He would also be managing the HMIS system, which is something that we have to do on an annual basis already.
Could you say what that, I know what that is, but could you say what that is?
Sure, Homeless Management Information System. So that's our homeless services database. We have all of our homeless service providers and correlated organizations provide documentation of their services in that system. So that's primarily what that individual would do. Any new grant opportunities and things like that would also be the responsibility of that person.
I think it's important to note the workload, the work product isn't changing. It's their legal relationship to the county that's changing. And upon further scrutiny, the definition of contract employee was maybe a little bit loose here, and it was determined that this really should be an employee. We don't want it to be a permanent employee. We're designated as a temporary employee with a fixed amount of time. But it's just, again, nothing's changing other than their relationship to the county government.
And the temporary employee ends April 18, 2025. Is that based on federal funding?
It's based on the initial resolution that indicated 3 years from the time of the approval of that agreement.
Is this part of the single point of entry?
Yes.
Okay.
Yes. So, yep, the homeless management information system is a collaborative sort of project with a coordinated entry or a single entry point system.
Okay, thank you, Hans. I know you worked hard at putting that resolution together. It was something a little bit different, so I appreciate that. Do we do a roll call? Yes, okay.
Wagner,
Yes.
Van Hoff,
Yes.
Shorten,
Yes.
Ness,
Yes.
Altoff,
Yes.
Von Bergen.
Yes. Okay, so we are on old business. And yeah, might as well stay up there, Hans. So we're going to discuss the Senior Service Grant Commission bylaws and some suggested changes that Hans came up with.
I'll make a motion to.
Okay.
I'll second.
Member Wagner, second by Member Ness. Okay.
So as indicated last time at this Public Health and Community Services Committee meeting, we had proposed revised revisions to the Senior Services Grant Commission bylaws, and the bylaws have been again revised to further clarify the roles of the county board members that would be placed onto the commission. In this case, the revisions include adding a person from the Finance Committee, Finance and Audit Committee, excuse me, Transportation Committee, and of course this committee, so that it spreads out the roles of the county board in terms of making those funding allocations and working with the commission. So other than that, nothing else had changed from the last meeting that we had. It just still includes a department or division of transportation staff person. Obviously transportation, big issue, so we definitely want to make sure that's included.
Any questions or comments on the proposed changes?
Is there any discussion of term limits? Who is the current chair of the CDBG, of the senior services?
I think that's named by the county board chairman.
Oh, okay,
Yes,
okay, so
but
it's.
I'm not sure that that's been
Okay, so
determined
it's,
yet.
it doesn't, yeah, okay.
I'll say, I think we sort of softly went into that question, thinking it would be the chair of PHCS. I think Tracy and Chairman Bueller have talked, and maybe that's not the designation that we're going to make. I'm going to work with Chairman Bueller next week in finding someone who wants to be the chair. If this resolution passes as drafted, we're going to need to look for committee members from Finance, Transportation, and PHCS. So those all need to come. Hans, I don't know what your meeting time frame is, because I'm sort of thinking we may need to pull these together next week and create an appointment resolution for next Friday.
I think that our next meeting is going to have to be in April.
Okay.
Typically the first meeting would be in February. Obviously, it doesn't look like that's going to happen. So April is going to be more of a meeting that's informative about the application process. Then in June, we have a meeting that affirms like how the application process works. September is the allocation hearings. So we would have to move the meeting for February, probably cancel that one.
So how is it configured? What's the change? Now it looks like this, which is what?
So now, formerly it had all the members of this committee on it.
Okay.
As far as the county board was concerned, it had a highway township supervisor as one of the individuals on there. Very challenging to fill that particular role. That was transferred over to the DOT position with the staff person coming on board. The other changes probably are just more clarifications and, revisions to how we define the individuals, et cetera, So the vice chairperson, for example, there was no process defined in there as to how that's selected. It's now included in there.
Okay, thank you, Hans.
And I'm reminded that for the last term, the chair of the Senior Service Grant Commission was not the chair of PHCS. It was a designee of the chairman. So we'll continue that practice.
Okay.
We're thinking about the schedule now, and I'm scrambling. If you're going to go with April meetings, we could go into the next round of committee meetings and have each committee select their recommendation.
So will that alter any plans that you have or they have for the Grant Commission?
So
Not
previously,
having a February?
it probably would make the April meeting slightly more lengthy, but commonly the February meeting, sometimes it had been in January, was more informative. So there would be organizations that would come in and make presentations. So this is going to be a little bit more, probably a little bit more of a robust April meeting rather than having a February meeting. But it won't change the process for the allocations.
Okay, so I would suggest that something be sent out to anybody who participates in this normal February meeting so they realize we're not abandoning the Grant Commission, it's just changing. And also for clarification, when we have the citizens at large, are those Were those chosen, we already approved some of those, right?
That's correct. Yep. This committee actually interviews those individuals and approves them, and then recommends them to the county board.
Okay. And so they, because I'm thinking Paula Jensen was chosen. Is she one of the at-large?
Yes.
Yes.
And that was chosen before the new, okay. And so they just stay on. Oh, that's right, they're 3-year terms.
Yep, and she actually replaced an individual who unfortunately passed away. So she's finishing out that particular
Right.
term.
Got it.
I'm thinking, we had Transportation Committee yesterday, this was not discussed. We can put the word out to the Transportation Committee members that they need to talk amongst themselves about who wants to represent. We can have a similar conversation with the Finance Committee next week. And then this body needs to share with the chair, if you're interested in representing this body, we can fold all those together next month.
I think we can get it done pretty quickly. So we might be able to still get it done in February, because that's scheduled for after the county board meeting.
Correct.
Correct.
Well, and most likely it would make sense to cancel the February meeting, so then by April, we'll definitely have those decisions made. That would allow a lot more time to kind of be thoughtful about it.
Okay.
Could do the last third of March if you wanted after the board meeting, but I guess it's kind of spring breakish.
Is that something we could discuss today? Or is that not on the agenda and we just have to hold off for the next month?
We don't have a defined process in the bylaws that were recommended, so, I mean.
If there was consensus amongst this body who wanted to represent this body, I'd be happy to share that with the chair. We will bring forward a resolution to vote on with all those names on it. And I can do the same with finance next week.
So we don't necessarily have to approve the person from here today.
You don't have to.
But if somebody was interested,
You can let
we
me know
could,
and I'll
we
pass
could talk about that and
on
pass
to-
that forward.
Yeah. Is everybody good with taking a person from the different number of committees? I really think it is a good idea. Transportation is the biggest issue with seniors, and I really feel like there should be somebody there from transportation, and the process does go through finance also. So I do think it's good to have someone from each of those committees.
So we're just talking the three, transportation, finance, and this group?
Yes.
Okay.
And then the chair would be somebody also from this group, a different person. So there would actually
think
be
it has to.
two. No?
Named by the county board chairperson, so that's that.
That's how I read it. It can be.
Okay.
Anybody, any county board member.
There's so
Any?
many different kinds. Sorry.
Okay.
I think you're still a child.
I am, I think.
Okay, so I guess we'll move this forward with a voice vote. So all in favor, aye.
Aye.
All those against, nay. Okay, great. Thank you very much, Hans. So we're going to move on to presentations. First one, Ms. Hartman, the Regional Office of Education.
Good morning. I have some handouts too I'm going to bring around. Nice to see all the new faces on the committee.
Thank you.
There you go. Very teachery of me. Oh, I'll let you. Well, good morning. I'm Diana Hartman, McHenry County Regional Office Superintendent. With me is Chris Zielinski. He's our Assistant Superintendent. And I came just to do a little overview of the ROE. So we're an intermediate state agency between the Illinois School Board State Board of Education and local school districts that performs regulatory functions. So we're not a county department. By statute, we'll come but I'll come more often, we'll come every quarter and we can report. But if you'd like to invite us, to talk about anything, I'd be happy to come and they're monthly meetings as well. So some of the duties, this is just a really broad overview, are on here. Chris is going to talk about some health life safety inspections. That's what HLS is. We do all the bus safety and training in the county. Actually, people might come from out of the county to take the classes too, because it's a mad rush to get into those classes. We do background checks. We have about 2 or 3 districts that will do some on their own, but we have that at the office as well. We assist people with their licensure. We offer professional learning to our educators in the county. We do compliance checks of all of the districts as well, which Chris will talk about in a little bit. High school equivalency, we are, by statute, we are supposed to be offering that, and one of, you've probably seen the move that we had to McHenry for the new ROE location. We'll be opening a Pearson Testing Center there. Where we're at with that right now is February 6th is the date that we are supposed to receive our computers. Once we get the computers, the things will go really fast and get approved and get going on that. We run a safe school, which is where students go to if they are expelled, close to being expelled, problematic in their home school environment. That is in Union right now. The lease was just terminated at the old elementary building for Marengo, so we will be looking for a new space for that. Truancy, we have a truancy officer that's funded by the county. We have an assistant truancy officer and an outreach specialist that's funded by my office through state dollars. So this last year, the state provided more money to focus on bringing truancy numbers down. School recognition, that's part of our compliance and health life safety inspections too, basically, and creating partnerships within the community. So some of the new partnerships that we have right now, one's called ABC Influencers, and that's with the Community Foundation, McHenry County Economic Development Corporation, and the ROE, where we are taking educators. We started with a pilot program with Huntley and Harvard, and we're taking educators to manufacturers in the county to let them see what type of job opportunities there are for students that maybe aren't going to college. And even if they are going to college, that what a wealth of jobs that we have in the county and the human capital that we need here, that it's a good place to return to, a place to work and live right here in McHenry County to keep that capital, that human capital right here. Another partnership that we have, I forgot the other one I wanted to highlight really quick, but there are several. We'll go on to the next slide. What? Yeah, so because that's so new, we've only had one meeting. I'll let you talk about that because that was yours. We're just in on it. So we'll go to the next slide.
All right, so like Ms. Hartman indicated, my name is Chris Linsky and I'm the Assistant Superintendent. I'm here actually to talk about one of the many obligations we have in the ROE, and that's health, life, and safety of schools. So the ROEs and ISCs across the state of Illinois, they have a shared obligation with the districts and to our communities that the public schools are a healthy and safe environment for the students and everybody who walk through the door. That's kind of the crux of HLS, and that's one of the obligations that statutorily we are part of. So how do we meet this obligation? Well, there's 3 big tenets in HLS, or health, life, and safety, that the ROE oversees that goes hand in hand with the districts to ensure some aspects of safety. Number 1 are those school inspections. Second one is permitting and occupancy of buildings. And the third one is 10-year safety surveys. And I'll talk a little bit about each of these before we're finished. So that first part, HLS school inspections. So I should point out that the ROEs, they are the authority having jurisdiction over school inspections. It's a partnership, it's in collaboration with the Office of the State Fire Marshal, but we are the agency that oversees that entire process. So every single public school district and every single public school in the entire state of Illinois is inspected annually by someone with the ROE or the ISC. So when we go through them, it's a checklist-based inspection approach. It's very robust, and I'll show you. If you look up in the screen, you'll see the checklist that we use every time we inspect every building. It's 320 individual items broadcasted over 33 groups. It's used across the entirety of the state. It's applied universally. And there's a parallel form that's used similar to this for when the Office of the State Fire Marshals is inspecting schools. So this is an obligation that we take very seriously. And when you look at this checklist, if you take some time to inspect it, and if you want a copy, just let us know and I can get you a copy of the packets for these. But it looks at both procedural and process aspects of safety as well as the physical environment itself. And what I mean by that is this. In the procedure and process aspects, we look, do schools have safety reference plans? Do they have crisis plans? Do they have crisis teams in place? And then from the physical aspects of the environment, we look at a variety of things, and a ton of things on this checklist. But we look at simple things like, is there emergency egress lighting? Are there emergency exits? Do the doors that are emergency exits, do they open freely for all the students? And also, do they shut and keep intruders out? So it's 320 things that we look through every time we go through every single building, and this happens in every public school. The ROE is at the forefront of this. The second part of HLS, or Health, Life, and Safety, that the ROE oversees is building permits and occupancy. So ROEs and ISCs, they have a responsibility for statutory compliance of standards of construction and remodeling of schools. And when that construction and remodeling is done, they also have the obligation to ensure that that environment is safe to occupy. So those are two separate processes. The first is the building permits. So we oversee and we issue building permits to any construction project that happens in public schools. Some of the things that come before us at the ROE is ensuring that there's school board approval, that the plans that are put forward not only are safe, but they also meet school compliance code. And that they've been reviewed and they've had a licensed architect and engineer as part of that process. And when that construction is completed and they want to occupy that space, it's the ROE again who goes through that process to make sure that the space is safe to be occupied by students, by staff, by anybody within the community. And when that's found to be the case, one of those four types of occupancies listed are garnered. It's either general occupancy, a partial occupancy, temporary facility if a district is using a mobile classroom due to space issues, or if there's a vehicular facility that they're using for instruction. And then finally, the third part of this obligation is a 10-year safety survey. So similar to the annual inspections, this happens in every single public school district and every single public school in the entirety of the state. So these 10-year safety surveys are really important because it's a collaborative effort between the school districts, the ROE, architects, engineers. They go through every single building every 10 years to make sure that all the work that's needed to bring schools up to school code, there's a plan to do it, and they're prepared to move forward with that plan. So they take all that information and they provide it over to the ROE. It's at the point of this, and we review this. We go through this and we set up a plan and make sure that they are on track for completion and compliance of these. So Health, Life, and Safety is one of the many things that we do at ROE, but I wanted to highlight this to you today. We do annual inspections, we oversee permits, we make sure that buildings are safe to occupy, we make sure that every 10 years, at minimum, they're going through that process to make sure that they're up to date and they meet school code. I want to thank you for your time. Welcome any questions.
Dumb question.
Yeah, go for it.
So what happens when you discover someone is not compliant?
That was my
question. I am not bright, I just was the first.
All the time.
So when that happens, the first thing we do is we work with the district. We make sure that they know what the obligations are in the district to find compliance, and then we work with them to make sure that they have a plan to go through it. They communicate that back with us, and then we'll wrap through. If it's something we find during HLS inspections, let's say an annual inspection that we find, run that back out to the district. We make sure they have the tools and the information. They need to know what that is. Sometimes it's just an understanding issue between school code and how that needs to be applied. We can help bridge that gap with that plan. Most of the time, if there's simple revisions, they can make those on site. If there's things that require construction, they might have to go through that permitting process to make sure we look through the plans, make sure it meets school codes before we approve it, And then once they get that permit to do that work, they have 6 months to start from that point on. Does
And
that
we-
answer the question?
And we like to take a service approach, so
Yeah.
we're there to show them, and sometimes it's a little bit of back and forth, show me the law, are you sure?
Mhm.
We go through all that process, and then it's a service approach to help them arm in arm to, become compliant.
Because at the end of the day, we-
Understood. I just know that, again, across the board, everybody's having some significant issues financially. And that there are some smaller school districts that struggle to find funds just to educate their students, much less provide an environment that promotes that endeavor. So I was just questioning.
You
And
can
it-
talk a little bit about
Maintenance
some things that
project.
grandfathered
Yeah.
in, and then also
Yeah.
the maintenance grant.
So there are a couple things, like she mentioned previously, some of those things are grandfathered in. So it depends on the time when the building was established, and that's the code that ascribes to. So there's some times where I'm looking at, I walk into an older building, I have to use a certain set of codes to see what was applicable at the time that it was built. And then if there is work that needs to be done, there are some grant opportunities for districts. There's a match grant through the state for them to provide some of that work for maintenance and safety, HLS.
So if someone is going to rehab a building or build a school, they are subject to local municipal building codes as well.
Correct, yes.
Correct.
Absolutely.
So are your codes aligned? So I guess the question
Yeah.
is there a redundancy here? I'm just asking.
Yeah, well, there's some aspects that building codes won't take into account when you're looking at an educational space. And so, building code is building code, fire code is fire code, but there's
Right.
also school code. So we have to make sure that it's a marriage of all those pieces that are met for the safety of the students and the staff. It's a great question. So in some
Well,
areas.
because we get, I get asked about lean government,
Sure. Yeah.
we have whatever. And so I want to be able to say, no, it's not a redundancy.
Correct.
And be able to answer that question.
Right.
But it sounds like a layered system from a building code perspective.
To some degree, like operationally for building codes, they're not gonna look at, do they have safety reference plans? Do they have emergency evacuation mapping and all the
Yeah, but the
classes?
fire department would require emergency evacuation.
They would,
correct?
and there's some things, so that checklist we have for the ROE, the Office of the State Fire Marshal has a parallel that's very similar to that, but when they go in, they're looking at a lot of fire codes. They look at specifically the fire code, whereas us, we have to look through statutorily to see exactly what's in the school code. And then when we do these inspections, the most ideal is to do it in conjunction with local municipality inspector for the fire department. So they hit a lot of the fire aspects, we hit a lot of the educational aspects.
And so there's going to be things like in Illinois school code, for example, there's a law in the books that there has to be feminine products in all the girls' bathrooms. That's not going to be on the fire marshal or the municipality building code, those types of things.
Great, thank you.
Great questions.
So the codes, the checklists that you go through, are these standards that are set by Illinois General Assembly, State Board of Education?
A variety of things. Some are aligned with local code, some are aligned with fire code, some are school code.
And there-
It's a variety.
And therefore, if it comes from school code, it's going to be coming from legislation. So typically, Illinois State Board of Education only takes it from the legislation.
So can we have a copy of the checklist?
Absolutely.
Okay,
Yeah.
great.
Member Wagner.
So I have a few questions. First, can we get a copy of this too?
Sure. We'll
Thank
send
you.
it to Kathy to send out.
Okay, thank you.
That's wonderful.
So, thank you for this presentation. When you and I met, when you first started, you talked about trying to obtain more grants, wondering how that process is going, and if you're focusing the grants on certain areas.
Sure. Well, with the state providing a lot more money, so we had about $184,000 for our ROE ISC grant in the prior year, right? So this year, for this school year, it tripled. And that was primarily for our safe school and for truancy. So, and with the parameters on that, it's sometimes hard to spend money in the parameters that you have, and you're like, oh, it'd be really good to do this kind of angle on it. So one of the things I did also We applied for a grant, a federal grant, did not get it, but it was the first time that we tried. And what I did was use, through MCC, they have the internship program. And they also have, outside of our local network, if it's just an online situation, then you could find somebody even nationally. So I found a student that was going into public health that we worked together to try to write our first federal grant. We did not receive it, but it was only like 100 and some people that did receive it, but it was a great process. It was a great learning process. So I have that, and I have all of the information below that. The other thing I did was go back and recoup all the grants that were grant money that we had left on the table, the ESSER grants and things like that. So there was definitely money there. Haven't branched out to write any more grants except that federal grant and just the state ones that are there. We have available to us that we'll be writing for a grant that will provide tuition reimbursement for people that are getting certification in English as a second language. So that was just opened, notified. We were just notified of that. So we'll be doing that one as well. Probably in the next month, I bet it'll become open. So we have guaranteed the state that we'll write for that one too.
The other thing that you guys are doing more of than the previous ROE is education and training. I know that there were some barriers to that. Just wondering how that's going.
Sure.
And what kind of classes you guys are holding for the school districts.
Great question. If you look on page 7 of this handout, these were the professional development administrator academies and some workshops that we put on throughout last school year. So we are always looking to partner. We do have partnerships with our drug-free grant through Laura Crane, and she has workshops going on as well that I didn't include in here, but these are specific to the ROE. The other thing that we are doing, we've also recouped what's called social emotional hub dollars, and we're in area 1 as an ROE. That means we're with Lake, Cook, Will, Grundy, Kane, DuPage, and us. And prior to that, McHenry wasn't taking advantage of this SEL hub grant. And so we get $70,000 to put towards anything social emotional that could be for kids, for staff, and for parents. So one of the things that we used that money for was bringing Dr. Steve Webb in just for the superintendents, and then some of the superintendents have had him come talk to their district as well. So we're starting a process in D15 using those dollars as well, and that's for them to basically have an assessment of their own school in those areas to figure out how are they going to deal with discipline, behavior, social, emotional topics within the school. So that grant is going for all the social, emotional. So we're doing that as well. Another thing that we're doing, one of the partnerships that I'm beginning is something that's called Teach McHenry County, as you probably have heard, and it just went public.
Yeah.
One of the ROEs across the state, a teacher shortage survey, and why it's happening, what can we do about it, all of those things. So Teach McHenry County, right now we're taking about a little over 100 students down to Illinois State University on March 6th. There is a conference just for high school students that are wanting to go into teaching. And just kind of like the sheriff's office has a cadet-ish program, we want to foster relationships with our high school students that want to go into teaching, mentor them, maybe bring them in, give them some expertise, things like that. And so we're going to start that this year as well, and the kickoff is going to be going down to Illinois State University for that student conference. And it is one of the career pathways that right now I believe it's only Huntley, Woodstock, and Crystal Lake has really started to get off the ground the pathway for teaching. So, and we're looking for more partnerships too, with MCC and others, but that's one of the new things we're working on as well.
I think it's amazing in the past few years, all the different partnerships and programs that have happened to guide these kids who are in high school. We all know that college isn't for everybody, so we have the internship program with manufacturing pathways. you guys are doing ABC influencers.
Correct.
And then there's also the School Links that's going on, and I know Crystal Lake's doing it, and a couple others are doing it. Actually, the county is combined with School Links too, and we've had different field trips. So, does the ROE anticipate working with School Links too, and those school districts? I know you have ABC influencers, and it's a little bit different than School
Right.
Links, but
Any way we can. There hasn't been an outreach yet for us to get involved. And what typically happens, it's a zero-sum based game where, I come from a business background, and it's hard to think of spend it all down to the zero, to the last penny, so you get to the end of the year and you can tell the school districts, okay, what'd you do in professional development? I can send you a check, I can reimburse you for that type of thing. So that's what I just did with the Teach McHenry County, which I just got approved from the state. So in that ROE ISC dollars, when we're deciding like what should we do, I was a little nervous that they're going to tell me no, but they said, okay, that's fine, work with Dan Bertrand. He goes, if you need to and you have extra money, I can funnel more money to Dan Bertrand and to use for the pathway for teaching as well. So I was pretty excited about that, because I want our students that are going into teaching to know that they don't have to leave McHenry County. We have great school districts. Pretty competitive pay. I mean, you can go a little further and get, 10 grand more, but you're not going to have what we have in McHenry County if you go into Lake and DuPage and all of that. So we're really going to sell them.
I have a couple of questions. I just want to be clear.
Yes.
English as a second language, you have the grant to reimburse students who take that at McHenry County College?
Well, the state just opened it up. They asked for reassurance. They asked by the end of last month, if you will not write it, please let us know.
Okay.
So it's a guaranteed grant, basically, if you write for it, submit for it. I have not read all of the ins and outs, but it's going to be to reimburse people that already are educators
Okay.
to get that endorsement.
Okay, but is it specific for McHenry County
No,
College?
no, it'll be
It
any.
could be anywhere
Right.
in the county.
And I also saw, so I'm going to be talking to the superintendents on the 10th. A lot of the bigger districts, or many of our districts, not all, of the 18 districts qualify for some of that as well. So they could choose to have us all go in together and us be the fiscal agent of it. For example, what if you're in Cary and you don't have any teachers? Well, why let that money go to waste if we have 6 in Harvard that will do it? So that's going to be my, kind of my pitch to the superintendents. Do you have enough to take it? Because if not, let's not leave it on the table. Let's pool it together and make sure we use it all.
I'm very interested in that. I'm going to be doing ES
Okay.
level at McHenry County College.
Okay.
And the other question I wanted to ask is, you mentioned truancy. You got a grant to work on that. What specific steps are you taking to reduce truancy?
That's great. Question. So on page 6, there's a few of the numbers that we had from last year. Now, there's a few caveats to this as well. Every district is going to have different policies with a little bit of leniency. Their numbers, we're not comparing apples to apples ever. We're never getting 100% accuracy in these numbers either from districts. Chronic, the way the definitions are crafted, chronic truancy means that would be alarming. If you hear this number, the statistic, it would be alarming, but that's going to include even every excused absence, even when your child is sick. So we're still in that coming out of COVID, stay home for 5 days, that come back with a mask on. My son just went through that as well, and you're getting a letter at home that your son has been out of school for 12 days this year, and that's alarming to, but that's their rules too. So I'd rather not look at the chronic truancy numbers, because that's going to really, and the number would be much higher really, but they're not reported accurately. But we do have students of all grades that are truant, and not due to illness and those types or vacations, and numbers aren't going up because of that. So what we are doing, we have Tim Dempsey, our truancy officer. We have an assistant truancy officer to Tim, And they pretty much split the county into districts. We had a meeting with the state's attorney's office to talk about, all angles from this. So if we do have to take someone into court, a parent into court, there needs to be some repercussions, there needs to be something done so that it's just not a never-ending cycle. Then the other thing that we added on was an outreach worker. So therefore, it's just not the hammer of the truancy officer or the truancy assistant trying to scare and, intimidate and manipulate them to get back into school, that we actually have somebody helping them connect them to resources within the community. So we have Alina Valadez, who is bilingual Spanish, and she can obviously, if the student needs clothes, if the parent is willing to have some dialogue on parenting techniques and behavior management, and if they're not, then maybe it's just a student issue. We have $10,000 set aside as well for counseling for any student or parent that would like to take advantage of that as well, if that will help them in their situation. So she's really working on connecting those families to any community agencies that might help them with whatever situation that they're in. And then Tim and Garrett Hard are there to take them to court if need be.
Okay, and just one final question.
Sure.
I'm wondering how these figures compare to pre-COVID. Do you have a record of, I know you came in
Yes, yes.
in the middle of all of this.
So on last year's, I would have to look. Last year's annual report is on the ROE website too, and I would have to look to see if they're on there. But if they're not, if truancy's not on there, I can get them from Tim. That's
Okay.
not
Yeah,
not.
I'm just curious how much
Yes.
of an impact
Yeah.
that would have
Yeah.
had, because I know it affected so many families.
Right.
Thank you.
Sure. Let's see if there's anything else I wanted to highlight in here as well.
Member Altoff had a question.
Yes.
I'm assuming you still attend and run the monthly meetings with the superintendents, correct? From all the districts, so that there's coordination or at least discussion at that high level as to what's going on.
So what we did when I came in is I had a monthly Zoom for the most part. And then starting next, this month now, February 10th, I'll be joining the superintendents, in the monthly meetings as well. Their monthly meetings. So
Yeah.
it was a little bit of, they got used to being mavericks and doing everything on their own, right? And they got used to figuring out their own professional development, and I'm trying to bring us together a little bit more cohesively. I've asked and hinted, let's maybe try, maybe we're not going to be a Kane County huge, everybody has the same institute day, but what if we have all the special ed, for professional development? Because I've had smaller districts say, well, I can't get a $10,000 speaker like Huntley can. I'm like, but the idea isn't that I give you $10,000 for a national speaker and I give you $10,000. It's we're all supposed to come together
Right.
and use it, so that's what we're still working on.
I just kind of want to highlight the opportunity you're taking
Yes.
to kind of coordinate that again.
Correct.
Because I will tell you, when I was still at that level, that was going on continually, and I thought it had some, real positive benefits. So
Absolutely.
Right.
delighted to hear that. And can I ask, what's the current enrollment at the SAFE school?
At the Safe School, we just had about 5 kids return, 1 graduate, so they are down to about 14 students right now.
That's great.
At the end of last year, we were up almost close to 50 students.
That's why I'm asking.
Yeah, they typically get more. I am hoping, when I go talk to the superintendents on February 10th, that's one of the discussions to see, what are their needs. There has been a little bit of talk of starting an alternative program, kind of an evening program, and that would be with Johnsburg, Richmond Burton, Alden Hebron. They're very interested in doing that as well. So there's some things that we're talking about. And now that the lease is terminated at Marengo, I think there might be other opportunities when we look for a new location too. Because it's so remote, right there.
It
And then
is,
it's
I
hard-
would agree, we've
Yeah.
always,
And then
always
what we-
complained about that.
And it's hard for resource allocation
Right.
in the middle of
And one of the things we were trying to do is with the pathways is that any student in the safe school, we wanted to try to offer them either automotive, fire science, early childhood, or culinary at NCC, and then have transportation, you know, to get them back and forth. And then the state really wants us to have every student in that program to have a job, even though they go down to 6th grade. And it's really hard to find 14-year-olds and 15-year-olds jobs, especially throughout a school year. Most places aren't going to hire those students. So, and being in that remote location, by the time they get back, there's just nothing available to do those types of things, you know, in this county. So maybe McHenry, Crystal Lake area, you know, will be better. I'm not quite sure yet. So we'll see. It's gonna be, but we're gonna move on and do something better than where we were, so.
Will certainly keep us in the loop on that.
Definitely.
Yeah. Thank you.
Yeah, absolutely.
Thank you, Madam Chair.
Let's see if there's anything else you want to highlight really quick. It's just interesting to see some of the school enrollment numbers on page 8, you know, all together. That's about it. And then we'll send the PowerPoint over to Kathy and she can send it out. Now too. Thank you so much.
Thanks for your time.
Thank you.
Thank you.
So next up, we have the Mental Health Board.
Good morning.
Good morning.
How are you?
Good morning.
Good morning.
Welcome.
Thank you.
Business cards as well.
That's good.
Very good. I have my business cards as well. You two have them, right?
Yes.
Okay. I handed out last year's annual report. We're in the process of doing our annual report at this time, and you will all receive a copy of it in March. So I'm Leonetta Rizzi. I think I know everyone here. Thank you for having me here. I'm the Executive Director of the McHenry County Mental Health Board. I've been in this role for the past year. So it's been a great experience really coming back to McHenry County and really evaluating what's been happening here in the county. I'm going to go through a deck that we use as kind of our general overview of the Mental Health Board. And then, you know, I'll go into more of some of the gaps and issues and so forth, just to give everyone a history. The McHenry County Mental Health Board really came out of the Community Mental Health Act in 1963. John F. Kennedy was the huge proponent who signed this law into act. He had Rosemary, his sister, who had intellectual developmental disability, and she struggled with behavioral health issues most of her young life. And he was a huge proponent of deinstitutionalizing and really having programs out in the community. From the Community Mental Health Act, Illinois put together House Bill 708, and that's why mental health boards are called 708 boards throughout the state of Illinois. And in 1967 is when our county here voted for the Community Mental Health Act in the referendum to establish the Mental Health Board. So again, it has a levy, and we are a special unit of government, truly under the Community Mental Health Act. And I really would encourage, if you haven't read the Community Mental Health Act, it's not very long, it's not really that dry, I think it's a little interesting, but it's really who governs us. So I would really encourage all of you to read the Community Mental Health Act and just better familiarize yourself with the Mental Health Board. Again, it also established our 9-member board, and through that 9-member board is really who enacts all of the responsibilities under the Community Mental Health Act. We currently have a $10.5 million budget, and we fund over 35 agencies and over 80 programs. And I know in some of the meetings that I've had with some of the board members, yes, our dollars were larger in the past. We used to fund over 100 programs, and our levy, was larger. And we can talk more about that later. But the Community Mental Health Act, again, under that, the main responsibilities, is really consulting with agencies, finding out the gaps, really initiating innovative programs and funding programs, having a written plan, executing and maintaining services, evaluating the programs that we fund. We have an audit process that we have in place, and it's a really great audit process. Actually, McHenry County auditors recently audited us, and we've gotten a lot of accolades. The report is coming, but regarding our audit process and the compliance procedures. So we really have a good process in place. And again, we have the authority to hire and set wages, and our annual levy is not supposed to be to exceed the 0.15%. So in Illinois, we are one of the oldest mental health boards in Illinois. Again, started in the late 60s, and as you see, the ones over on the right, we have some new mental health boards that have just come into play. So there's still mental health boards across the country, across Illinois, that are being established. And again, we are one of the oldest, and we sit on one of our associations, and we play a leadership role there. Our main mission is to really lead and contract for behavioral health, substance use disorders, and intellectual developmental disability prevention and treatment services for all people in McHenry County. So, that really is our main goal. And really, we want to see access into services and really high quality services. We have a 3-year plan that we're in the process of finalizing that last year, and we're going to be developing our next 3-year plan. So that's where I really would encourage, and I know I was going to be talking to Scott further, the things that come up from the county side regarding mental health, if you could funnel those pieces to us, we would like to take responsibility for the mental health initiatives. So again, we're in the process of going to be starting our 3-year plan as well. As far as operationally, the board of directors play a huge role with the McHenry County Mental Health Board. We have a staff that is very efficient. We are about 2/3 the size of what it was, or 2/3 less. We're 1/3 the size of what it used to be, actually. We have a funding allocation process which starts, we accept applications normally in June, and that is through July, and then staff and board members review those applications, and in October we make our final decisions for the December 1 funding cycle. We are CARF accredited, and we're very proud of that accreditation. We're one of the few mental health boards that has a network of providers that fall under us under the CARF accreditation as a network. As you know, some of the small providers don't have the ability to have either fiscally and operationally to have an accreditation, to be under an accreditation cycle. So through us, through our funding, we are able to get them into our network, and we track outcomes as part of CARF, and we have this whole quality network procedure.
Could you just say what CARF is?
Sure, it's the Commission of Accreditation of Rehab Facilities. So it's very similar to like Joint Commission on the hospital and healthcare side. I think a lot of people know Joint Commission. So it's an accrediting body that has statutes and compliance on a quality measure, and it really meeting that accreditation is huge. So we're one of the few mental health boards that is accredited as a network, and we're really proud of that accreditation. We actually are going to be having our CARF survey this next year, and they always include our providers because again, we're accredited as a network. Network Council, I know Kelly did come out to Network Council in January. We're very proud of having this Network Council. Again, they're all our provided entities who are funded by the Mental Health Board, who meet monthly, and they're more on a leadership level, who attend these meetings, and, you know, they're a large group, and they're very committed. One of the things, I think, the benefit of the Mental Health Board and also being in this community for so long is the collaboration, the amount of collaboration that exists in this county. And Network Council is an example of that, that as this county has grown and as our funding has grown over the years, and programs have grown, we've been able to maintain this network of providers that is very collaborative. So I would really encourage all of you at some point to attend a Network Council meeting. It meets every fourth Monday at 8:30. And if you can let us know, because we would like to, let the Network Council members know of your attendance. But I would really encourage you to attend one of those meetings at some point in the future. And then we also have a quality management team meeting. We have a lot of network-driven meetings. The quality management team meeting, again, is a mental health board driven meeting that involves all the quality folks from all the provided agencies. And they review all not only the CARF quality domains, but just other quality metrics that we're seeing in the county. So that is a monthly meeting, or quarterly meeting. We also have a monthly intake coordinators meeting, which is of great value. Again, a mental health board driven meeting, and that's all the intake coordinators of all the agencies that get together monthly. They do presentations, because if you can imagine being a provider and having somebody come into your agency, and if you're not able to serve them, or if they're just not in the right place, of where do you send them? Where do they go? So it's an invaluable meeting for these intake coordinators, because they get to learn all the other providers, all the other eligibility. They know who to call, even if they can't remember what the eligibility criteria is. So it's just a great network. So we're really proud of the intake coordinators meeting as well. I think that has really helped to guide McHenry County residents to the right places. We also provide clinical reviews. So if there's tough cases that our providers are having a hard time dealing with or needing collaboration, we provide a way of gathering everyone together for what's called a clinical review on a case. And I talked about a little bit about our compliance audits and outcomes and data reporting. So we do have an ethics and compliance committee on the board level that all of these roll up to. And actually we will be meeting next week for our for our Q1 outcomes. So we do, on a board level, also review all these outcomes from the provider side. And the audits, again, there's an audit schedule that is pretty regiment. And for example, we have a new provider into our system, Northern Illinois Recovery Center. We are funding for the unfunded patients, detox. So they're new in the system, so they're going to be audited probably first thing in February, because they are new, and just kind of getting them used to our audit process and what we expect from that. So we do have routine audits and data reporting that comes into the mental health board. One of the other benefits of being a provider agency is the network training that we provide. So the mental health board provides a lot of network training for the providers and their CEUs that are available for them, and almost all of it is no cost to the providers. So we incur the training, it's part of our budget, and the providers are receiving these benefits. So there's a benefit to being in our provider network. And again, we believe that we are fiscal stewards, and the financial standards that we uphold to our county. And this is from the annual report from last year, and it gives you a breakdown of the funds. So obviously, mental health, 1 in 5 people. Oh, Pam, you have a question?
I'm just saying it to throw it out there so that
Is
it's
it
out
accurate?
there. Yeah, I'm assuming, you can throw this, that you take your outcomes and your data reporting and you roll that into your strategic planning for the balance of the 3 years? I mean, it's implied, but you didn't state it, but I just kind
Yes.
of wanted, okay.
Yes, yes, definitely we
Yeah.
do that.
Yeah.
Absolutely. So, this is from our annual report from last year. Mental health is what we fund the largest, and again, that's also due to the need. 1 in 5 people have experience of mental illness every year. So, mental health is the huge piece. Intellectual developmental disabilities, 1 in 10 have a family member with an intellectual developmental disability, so, that is a high funding piece. And substance abuse, that's a little harder to track because it's like 1 in 18 are the records, but that's because of the ones that are actually treated and diagnosed. A lot of the research shows that it's really even probably closer to 1 in 10. So we do fund all 3, and then we also fund programs that are more co-occurring with mental health and substance use disorder. And we have different funding types. We have fee-for-service, that basically is just that we fund it per service area. So if they're going out doing an assessment, we'll fund that assessment piece. Otherwise, we have the full grants, and we also have what we call a pay-for-performance, which is more of a psychiatry type of grant. And then we also purchase positions, and these positions are usually positions that are not billable positions for our providers, but they're very needed positions. And hopefully, the positions also will be sustainable in the future as they grow. Any questions on funding? And then, again, in general, there's a wide array of services that the network provides through the funding. And again, we just talked about the new service is detox that we are also going to be providing in this next year. And again, I talked about the events and trainings, and we host an annual suicide prevention and recovery conference in the fall. We host a school and behavioral health quarterly meetings. Actually, we have one this Friday, and that's been very instrumental for the schools. Diane isn't here right now, but that has been very instrumental for the schools and very helpful for them to have that linkage of quarterly meetings with school professionals and behavioral health, and these are virtual meetings at this time. Again, we talked about the trainings we provide, and we have ongoing community trainings. The QPR, question, persuade, and refer is a suicide prevention training that we really encourage throughout the whole community. We have mental health first aid, both for youth and for adults. And our adverse childhood experiences, we've renamed to trauma informed. So we've renamed the ACEs to trauma informed since people are more familiar with that terminology. We have a weekly hot sheet that the Mental Health Board maintains. It has all our educational training. It's on our website, but it also has other information for providers. The providers list support groups that they're on there, which are also available on our website. But they also have job openings. So it's an informational hot sheet for the providers, and they find it beneficial. We use social media. The website again has our directory. So we have an information and referral directory on our website that we maintain as well. And again, we're involved in lots of meetings, both internal and external, throughout the county. And service navigation, besides our website, which has a service directory, we also have a McHelp app that you can download on your. If you don't have it, I would encourage you to. You can take a picture of the QR code here and download it if you don't have it on your app. And if you can, help promote this throughout the county. We do have these bookmarks that we send to schools and anywhere, but if you can help promote McHelp, it is very helpful because a lot of people don't know, one of the things we hear and we're constantly promoting is I don't know how to access services, I don't know where to go. And we don't know what else we can do. We constantly try versus our radio spots on Star 105.5, our presentations. I mean, we even had a recent new board member, I don't know if you remember the interview, but when she applied, she even said, oh yeah, I really want to help with getting information because when I came to this county, I didn't know where to turn. So that's our dilemma, even new people who come in, how do we get that information out? So we have the resources and we have this app. And this app is wonderful, it's basically our directory, and it also has a text and a chat feature that if people are needing further help, they can get that help.
Do you provide those bookmarks or any kind of information to the realtors in McHenry County?
That's a good idea. I will have to check
Filled
with
with
my
Yeah.
team. That is a really good idea.
All the realtors have a packet of information that they've, and I mean everyone, every entity you can think of out there, you know, all the way down,
Okay.
provides a welcome to the community packet. Put it in there.
That's a great idea. Thank you, Pam. I will not forget that because that is a great idea. And I will check to see.
If you have
that's part of
difficulty,
our-
you call me. But they do. They're always
Yeah,
looking for
and that's a great
information.
idea.
Yeah. Mhm.
That's a great idea. And then 988. 988, as you guys have heard, is the new line that is the national line now. And that's the line that we're promoting at this point because it has the mobile crisis response component attached to it. So we are promoting the 988 suicide prevention crisis line, and 211 is also the information referral for our county, so that's also a service navigation link. And then Youth and Family Center, they provide more service navigation for the Hispanic population, and yeah, they have bilingual services there, so we really encourage that. Service navigation for the IDD population is Service Inc., and they do a great job.
Could
And
you
that-
say what IDD is?
Intellectual and developmental disabilities.
That's, you
You
know,
have
like,
to remember, some people don't know what those, yeah,
that's me.
Thank you.
You're welcome.
And then people in need forum,
Anybody though.
I don't know how many of you have attended People in Need Forum. I know I saw some of you on Saturday, but that is a great, again, service navigation opportunity that we have in this community. So that is our board and staff, and really the end of the, what I call Mental Health Board 101 presentation. But I just wanted to give you a little bit more feedback, since some of you have attended Network Council and have heard some of the gaps and so forth, and I'm sure that's going to be one of the questions, so let me just tell you. You know, with our, one of the things that is that we've got the $10.5 million budget. Just to let you know, we had $2.5 million in excess of demand. Then we were able to fund our providers. And the same was true in the previous year. So it's been a continuous piece that we're not keeping up with the growth of our current providers, because 98% of that, 2.5, were from our current providers. And we've started what's called a funders forum. Is Hans still here? Yeah.
Yes.
And we're happy. We have the, you know, Hans, we have Community Foundation, and we have United Way. And we've gotten together recently, and we're looking at, you know, just who are we funding? And I can tell that people are going to the other funding agencies because we're not able to fund them at the level that they need. So I just want to bring that to everyone's attention, that you know, that is an issue, let alone bring in somebody new. For instance, we brought in Northern Illinois Recovery Center, and as a result, we had to cut other providers in order to bring somebody new in. So that's what's really difficult for us.
So when was the last time you raised the levy?
It was reduced, it hasn't been raised.
So I see, that's a problem for me.
Right, and we're having the discussion with our board. We start our budget process in March, So we started early so that we're ready for the county process. But I don't know how we can not do that.
Well, that levy is there through the law for this reason, for you to be able to meet future needs of a growing county. And to not raise it means you can't do exactly what the county did with their tax levy, which
Right.
meets the COLA, whatever. And when you reduce it, you're like 10 steps behind.
Right.
Are you requesting a increase in the mental health levy in this budget
Our
cycle?
board is gonna be deliberating that.
Well, I would encourage you to do that, and I think it's the board's responsibility
Right.
to support that. I know,
Right.
that's.
Was it
well, and-
3
and-
years ago that it was reduced, or was it longer?
Yeah, Pete, when was it reduced? Do you remember?
The final debt payments on the building were made about 3 years ago.
Okay,
And
that's what I thought.
it was coordinated with that.
Like that.
Yeah.
Yeah.
Still,
You're right, it wasn't quite as draconian as it maybe was presented, because there was the same service dollars were still available, but the debt payments.
well, yeah, but they couldn't, I'm a former service provider, so I get what happens. You can't, you just sustain,
Right.
Yes.
and you lose ground.
Right.
Yeah,
And
it's
that's-
not even
and that's what I
sustained.
see,
Yeah.
that's
It-
what I
it-
see happening.
Chip away at it.
That's
yeah.
right.
That's what I see happening right now.
Yeah.
What's
And-
the highest amount of grant dollars you've been able to give in the past, I don't know, 10 years? Has it been higher than the 10 million?
Yes, yes.
What was it, what was the highest?
I think 14 from what Ray, our treasurer, has, I'm gonna be presenting this to you in the future.
We do, Leonette and I met yesterday with the state attorney's office and outside counsel as it relates to the opioid settlements. And we do anticipate at least another $500,000 to be available as part of this next round of allocations in the opioid area. So that will be of assistance to some.
To some.
To some.
To some.
But only once.
Right.
Some
Well,
assistance
Yeah.
once.
Well,
No.
it's actually 18 years,
Okay.
but it's gonna be, we don't know what the dollars are gonna be. Like, they're saying for next year it might be 100,000, so we're not sure what's gonna be coming in these opioid
So every
dollars.
year it's gonna change depending
Yes,
on.
every year it's gonna change and we don't know
You
what the
have,
amount
you
is.
have multiple settlements, you have settlements with Janssen, you have settlements with distributors.
Pharmacies.
We have Purdue Pharma that's pending, that's going to the Supreme Court. We've got pending settlements with Walgreens, CVS. So
Right.
and all of these settlements have multi-year schedules that vary each year. So it is going to fluctuate, unfortunately.
Right.
I think Leonetta and her board are going to be able to anticipate some dollars every year for many years. And we're going to bring an agreement to this body next month to kind of talk about when those dollars come in that are immediately flowing over
To the mental health.
to our law.
And again, we're not taking any administrative, we're giving it all to the, providers, but this is substance abuse providers and specifically opioid, and we're hoping it's new. It's, some newer programs too that can come in. So it's still not, again, it won't meet the growth of our providers that we currently have for mental health and IDD, but it'll help on the substance abuse side.
And so, it's always, to me, it's always education. I apologize, Tracy, may speak. It's always the information that flows out. And, I caution all of us when we talk about those monies that we're going to get, that in the general public, they don't perceive that as, again, extra money that's coming in for everything. It's very specific.
It's very specific.
And it still isn't going to address potentially the issues that Lou references, which is as our county grows, and even as it doesn't, the demand for those types of services continually increases, and the cost of providing same services continually increase. We need to do a better job in educating our public on what we're doing and what our limitations are, and not confusing additional dollars
Right.
as answering the question to all of those services.
I agree with that.
It's a
because
toughie.
It is tough because the opioid dollars are specific and it's a specific abatement program. It'll be wonderful. It'll help because, you know, we do have an opioid epidemic, and it will help in that area, but it's very specific.
But what I'm also saying too is as we go forward and we talk to our constituents, they're gonna see some of that as we're increasing programs. And how can we increase programs if we don't have enough money?
Right.
And we're talking about increasing the levy. You know, it doesn't
Right.
seem to connect the dots, and so, you know, I would suggest that if that's something your board chooses to do and presents to the county, that we come up with a unified message so that we're all saying the same thing, so we're not confusing the issues. That's all I'm asking.
No, that's great. That's great.
And I
So-
don't want to forget that the levy is designed in its original intent to protect the integrity of mental health services in a community, apart from additional funding that may or may not flow, or that the levy is the rock and foundation of serving the community. And to me, I know people are all, you know, we can't increase taxes, but if we could continue to encourage our constituents to understand the mental health tax levy is significantly important to the health and well-being, and you should have the authority. If you say to this body, I want to raise the levy by what, and here's what I'm going to do with it, and here's why I want to do it, and here's the, we should rely on your good judgment, and because you're the expert at the table, not me.
And you know, when I was in this county last to where it is today, there's gaps. There's major gaps that used to exist that aren't here today. I mean, there's still gaps that, you know, we don't have an adolescent inpatient treatment program. You know, psychiatry services is still difficult. I mean, we got a call yesterday with somebody trying to get into a psychiatrist, and there's huge waiting lists. And we see them because we also track waiting lists for our providers. You know, that's huge. On the intellectual developmental disability side, you know, we really have a need for, you know, supportive housing, more housing in the community, but also residential. They send, the closest state residential is down south, 3 hours away. Many times they're sending patients outside to New York. For example, is like the furthest we've sent patients out. So we still continue to have gaps, and then we talk about, you know, the affordable housing and all those that came up at Network Council, transportation. There's a good portion of our dollars that are going to transportation. We have transportation grants that we provide for our providers, and the transportation grants are smaller grants. The most they can have is $3,000 if they qualify for both serving mental health is $1,000. Intellectual developmental disabilities is $1,000, substance use disorders $1,000. So they can have bus tokens or gas cards for those. But we have this other platform called the Kaizen platform, which is a remarkable platform. It's been very, very helpful. But when we started in this platform, I think it was like a minimal, like $30,000 of a budget. We are over 200,000. Providing a budget for transportation for our providers. And what this Kaizen platform does is utilizes, it's a centralized service, and it's all automated online platform that we approve some providers to utilize for behavioral health treatment, recovery treatment only. So it's for getting people to treatment as a last resort. So it's not something meant for everyday treatment or if they're in an IOP program to get there, but it's supposed to be used as a last resort. And we've had conversations with the 22nd Judicial, for example, the drug courts are also utilizing it. They utilize half of this budget. So again, we're providing a lot of services, you know, for our providers in the community as well as county departments. So that transportation dollars, you know, I know our board's looking at because it's needed, but it also takes away from services. So, you know, we're really evaluating all of that ourselves at this time. So those are the challenges, you know, that we're facing along with you know, the opioid crisis, the suicide rate, which, you know, our suicide rate here has increased. We've had more deaths this year, deaths by suicide, than deaths by overdose. So, you know, that's been a switch. So we've had a lot of challenges that we have coming up, and our community needs assessment, as you all know, showed that behavioral health is the #1 priority, which includes both mental health and substance use. So I do think that we have investments that we can make to really come up with better solutions for these challenges. Yeah, Kelly.
I would urge, if anybody has not taken the QPR, to take it. It is very eye-opening. I learned a lot, and wow. But my question, if you can go back to one of the first slides you had, when you were talking about, you had the map, and it was, you said we were one of the first mental health boards. Keep going. Oh, that's what that's doing. Okay, so it says here, Developmental Disabilities Board.
Yes.
So I was just
377.
wondering what that is different in, is
Yeah.
ours incorporated with that, or how does it work?
Yeah, it's different. There's some, by statute, the mental health board includes all three, but there are some boards that are just intellectual developmental disability boards that have been created. That's a different statute. So ours includes all of it. So if you are a 708 board, mental health board, you include all three. But there are some counties who have just that element.
Okay.
Yeah, and what was really interesting, I met with the ARC of Illinois recently, which is really for intellectual developmental disabilities, and really she came in, she's a new executive director, and she was unaware that 708 boards included intellectual developmental disabilities. So it was a really great network, you know, really including her in, because, you know, we're really looking at from a strategic level, you know, how can we all work together in partnerships in those associations. But yeah.
Thank you for the clarification.
Any other questions? That's really it. I know I started a year ago, and I don't believe we did these kind of presentations. So,
These are for the new board.
oh, for the new board, okay.
You'll be doing it again.
But not too soon.
2 years.
Yeah. Yeah, so this is great. So thank you for this time.
Thank you, Lisa.
Thank you for coming in and explaining a lot of our programs that are
Thank you.
definitely needed. Is Mike here? No? Okay. Well then,
I think we can move on to workforce act.
Okay.
We made Mike aware, I don't know.
Maybe next month. Okay. So we'll move forward with Workforce Network Board.
Thank you. Oh, jeez Louise. Sorry.
Everything in here.
Thank you. Oh, I can get
Yeah. So, I think I should. Yeah, I have to take. should.
How about
Yeah.
a couple, well,
Give them a
yeah,
moment.
maybe wait a couple minutes till they get back from most likely a break.
So we'll run a minute break.
You want to sneak out too? Okay. How about we take a 5-minute restroom break? Okay, I think we're good to go.
Hello, my name is Jay Brown. I am the McHenry County Workforce Network Board Director. And with me today is Jeffrey Pointer. He's the McHenry County Workforce Network Director. I'll get into what is the difference and kind of how that all plays together in a little bit. So starting with why workforce. So we provide workforce investment activities for the community. So these are statewide and local investment systems that we're coming together as a local unit to make sure we're addressing the needs of our community through, I always usually like to say, we're helping smooth out that workforce. So we're taking individuals who are getting laid off from low growth industries or possibly a low growth position, and we're trying to help them get into a high growth position where there's needs in the community. We're also working with the most in need. So we're working with individuals with barriers, we're working with people who are low income and need to develop a career pathway so they can sustain going forward. We're also working with individuals with disabilities, individuals coming out of the prison system, making sure they're sustaining and developing a solid career path. So some of the things that I want to highlight, we're here to improve the quality of the workforce. We're also here to reduce the welfare dependency and enhance the productivity and competitiveness of the nation. So really when we're working with individuals who are on low income, who may be on SNAP benefits, our goal is to work with them to get off of those SNAP benefits, get a job where they can sustain, and they can also live here in the county. I know that's been a big thing with housing, so we're helping and we can provide referrals and we're connected with the Housing Authority to make sure they get a more well-rounded situation. So what is the workforce? We run under a federal act, so we're a federal job training program designed to, we use federal money to then help individuals develop those pathways. So I'll get into in a little bit what all the tools we have to use through those pathways, but with that, really our focus is on that individual. So we're going through, we're working with them one-on-one to develop what pathway they would like, and trying to make and seeing if it aligns also with the high growth needs. So what is in need within our communities. So the act that we run under is called the Workforce Innovation Opportunity Act. So the acronym, starting from the beginning, is WIOA. So that WIOA Act was established in July 2014, and it was authorized, previously it was called the Workforce Investment Act, and we're coming up to reauthorization as well going forward. So right now, it's still the WIOA Act. So through that act, each state must use a single unified state plan covering all the core programs with alignment from the state level to the regional level to the local level. So it goes, our money starts from federal, it goes down to the state then allocates it to our local level, so here with the county. WIOA requires the plan to have very specific requirements and measurables. So when we are working with individuals, we have performance measures that align with our programs. So those performance measures are more dictated on, are people getting jobs? Are they gaining skills? So this was again that alignment. So starting with the state has a state plan that overviews how WIOA and the state will facilitate the grant. Then we have regional initiatives. So these are showing regionally what is in need and our region is the northeastern side of Illinois. And then we filter down to the local plan. And that local plan is really dictating how are we facilitating our program. Yeah.
So just regionally, I see there's blue around some areas, just wondering what the different breakouts are, the blue and the dotted lines. Or does that
Those are the workforce.
Those are the workforce areas. The state breaks up the state into 10 economic development regions, and that defines our region. And Economic Development Region, Region 4, the Northeast Economic Development Region of Illinois, contains 10 counties or 7 workforce areas.
Okay.
And this points out that we're fortunate that we got a single county workforce board.
You have McHenry, Lake, and Cook County are the single county LWIAs, or local workforce areas. Others are combined with other counties. It really does give us a unique ability to address the local needs.
So if I'm looking at the middle map there, we're not in the same region with Cook County or Lake.
No, that is the economic development region. It is all those counties.
Okay.
Kane, Kendall, and DeKalb make up a local workforce area. Kankakee, Grundy, and actually they have another county that straddles into another economic development region. I'm sorry, Will County is also a single.
Jeff's peer, Jake's peer in Kane, Kendall, DeKalb do all 3 counties.
Work with 3 counties.
Yeah. And the board members come from all 3 counties.
So think of it, because we're a federal act, all states, and then for Illinois, we're broke up into those local workforce areas. So all states will have local workforce areas as well, and we're all facilitating the same program. So when you're looking at that, like McHenry, here we're facilitating that WIO program. Lake County will facilitate the same one, but when they're combined, there's multiple counties, then just that one, the combination of the local workforce areas facilitating in one program. So kind of mentioned a little bit where the money is flowing from. So again, really our money is dictated from the federal government. So when the federal government releases an allocation to the state, then the state has a formula and we get allocation from them. That formula will change each year. So usually we don't know what our allocations are until roughly around April to start our program year starting in July. So with that, last year we took a hit of about $300,000. Some years we will go up, some years we will go down. Yeah.
The formula that calculates how much of the federal dollars we get, is that, how is that determined?
There's a number of factors that go into that. It has to do with demographic changes that historically projected. It has to do with number of business establishments, employment, the labor force participation rate, your age demographics, how many people flow in and out of your county for employment. It's the same formula is applied by Department of Labor for the state allocation. The state duplicates that by the local workforce area with the demographics that come from the Bureau of Labor Statistics and the Illinois Department of Employment Security, and the American Community Survey through the census.
And the $300,000, there was a drop?
Actually, the state lost about 6.4%, and most of that money went to states like California and Texas.
Okay.
In the state, only 2 workforce areas saw increases this year. Everybody else saw losses. The prior funding year for us, we did see an increase, and we were only one of 4 in the state that saw the funding increase. So we went down from 1.9 to 1.6 million in funding on our base allocation.
Okay. Thank you.
So again, it fluctuates each year. Like I said, like Jeff said, last year we got more money. This year we lost a little bit more money. So it really depends on where a lot of that demographic's going.
We have such a low unemployment rate that the better we do, sometimes it's like a double-edged sword.
Very much so. So this is an example of a $2 million budget, how we're splitting up that money. So we're utilizing half the amount into our youth program, and then the adult program and dislocated program. Let me explain a little bit what that means. So adult program is working with individuals with more specific barriers. These are low-income individuals. These are individuals who need that assistance to get past and get out of a financial need. Our dislocated worker is the individuals who were laid off from the low growth industries.
we serve a population anywhere from ages 14 on to whenever they decide not to work. Our youth programming serves 16 to 24-year-olds. We can work down to 14 if it's needed.
And our youth program is really, and these are our tools that we use to help with career development. So when it says occupational skills training, think of those as scholarships. We can provide scholarships to individuals to help pay for training. We can help if it's a non-healthcare related field, up to $7,000 for a training program. And if it is a healthcare related field, it can be up to $10,000 for a training program. So those trainings are facilitated. It could very much can be local here with the local community colleges. So with McHenry County College, some individuals, depending on the training need, may have to go outside of the county for training, but we're working with them to make sure it's going to be the best fit for them. So we're not sending people to like East St. Louis for training. We're making sure it's somewhat local. They're getting the skills they need to get into the careers they want. With that, we're also helping provide support services. So those support services focus on transportation reimbursement and also childcare. With that too, with those occupational skills trainings, those scholarships, we're covering everything associated to it. So that includes books. If it's like a nursing program, we're helping with the cost of uniforms and whatever requirements they need. So it's really all encompassing. We don't want them to be without during the programs. And then we're managing that amounts that we have. So we're working with them to make sure if a program is going to be more than the amounts that we can help fund, then how are they going to meet that funding? So our caseworkers work with them to make sure that's discussed and they have a plan of action. So some of the other trainings with that youth program we can also do is a work experience. This is our term for internship. So we've done internships throughout the whole county in a lot of different fields. We have actually several interns here with the county. They mentioned Laura Crane, one of our interns is working with her with Department of Education. And with that, we go off of the intern's interests. Think of this as a way of us helping build skills for individuals when they need to get those entry-level jobs. A lot of times you hear, how do you get experience when no one's willing to give you experience? This is our way to get that into the door. One of the other areas we can help with is taking that a step further. It's called on-the-job training. So on-the-job training is when an individual is actually hired by our organization, and then we're helping develop a training plan for them. And then we're helping that organization as well, because we all know training costs money. We're providing some funds back for that training program. So that is half of the wage that they're going to be going through during the design program. And usually those design programs, it depends on what is needed for the training, but usually they'll last between 3 to 6 months. Again, depends on the position. So our adult program, very much is similar to that youth program, but we're working with those different populations. So we're working with more specifically the low income, those dislocated workers. So we use the same tools. So we still have those scholarship opportunities. We still have the support services and also those work experiences and on-the-job trainings. So how the McHenry County Workforce Board structure, so the board is designed to make sure we're addressing the initiatives and what's the needs of the community. So with that, 50% of our board is made up of businesses, so that allows us to know what's going on with the different local businesses. So they're bringing in information and providing and helping provide and know what is really the skill gap. We also have representation from our education and training areas. So our local community college, McHenry County College, is represented on there. We also have a local training provider who does medical assisting is represented on there as well. We also have representatives of the workforce. Luckily, Jeff is a great representative for us on our board. And then we also have representatives of the government. Kelly is luckily enough on ours as our board liaison. And we also different entities. So we have Department of Human Services on our board, who they cover more of that welfare area. We also have individuals from Department of Rehabilitation Services. That is the state agency that works with individuals with disabilities to help find employment. So we're all built and made up together for the board to making sure we're addressing the needs of our community.
The composition of the workforce board is specifically designed within the Workforce Innovation and Opportunity Act. It's really spelled out. So it has to have economic development. It has to have representatives from the Transitional Aid and Needy Family Program, the TANF program. It has to have the Division of Vocational Rehabilitation. It has to have representatives from labor. 20% of the board has to be made up of organized labor representation. It has to have, I've done so many things I forget. It has to have workforce development. It has to have adult education representation. It is very specific ratios that we have to maintain. Jake manages a board of right now 24 members.
So I just had a question. I know you mentioned for education, that piece, that you have representation from McHenry County College. Does it include any representation from the high schools?
They do participate in the youth committee, and they also participate in our business resource team.
Okay.
So they're there as members of the committees that work with the board.
Okay.
Yeah, and we work very heavily with them in our program side too. So making sure we're connected all throughout. So staff requirements. We have 12 full-time staff that make up the workforce network. And the split, so I'm working on the board. I'm the sole individual working with the board, and Jeff is working with the program side. So he has, going to the next list, a staff that is facilitating that workforce development program for the county. So he has a business service team, he has a young adult team, and then he has the career planners focus a little bit more on that adult side.
When you think about the board and you think about the workforce network piece, one is more policy and strategy development. The other, the network itself, is putting the boots on the ground and delivering the services. The board doesn't deliver the services, but they look at all the legislation and the direction from the Department of Labor and from the Department of Commerce and Economic Opportunity, DCO, and the state workforce board, the IWEB, Illinois Workforce Innovation Opportunity Board, at their policies, their direction, and the state and regional and local plans to make it happen here. So.
Then I want to direct to some of the brochures that we handed out. So you will see the 2022 WIOA report, and if you go in there, this report is going to give you some great numbers on who we've helped, kind of where that money is being spent. So if you get a chance to look over that, I did give everyone a copy of our bigger report. This will take a little bit longer to read, but I trust you, it's got some fantastic information. When I put this together this year, really the focus is to make sure everyone is informed on where our numbers are. Right now, Jeff was saying, our unemployment is very low. We're roughly straddling, it ranges each month between like 3.4 to 3.6%. And usually when we're under 4%, it means our unemployment is very low. So with that, in this packet, in this information, you're going to see some great understanding of where the workforce is going, where potentially a lot of migration to different counties where they're working outside of the county, but you're going to see also influx of some individuals coming in. We're also seeing an aging population where there is individuals coming up to retirement age. So with that, they may be going out of the workforce. Now, it's understandably that individuals are working longer. So those numbers right now, they look at any individual over 55 potentially starting to think about retirement.
We had it brought up at one of our board meetings, and the owner of First Institute, I should be retired. It was like they throw out these numbers, and it's 55, and we know that most people are retiring.
Yeah, and that,
Much older.
that age is being pushed more and
Yeah.
more. So depending on need and also with the community, also we're having the aging population of the workforce that we're seeing the needs from organizations. They're still having individuals into their late 60s, early 70s still working because they want to work. But then we're trying to help backfill those positions, especially in that manufacturing area where the individuals have such skilled labor, trying to help get more into that field. Then the last document I wanted to highlight was our brochure. This is our activities that we have at our center. So with that, we do a lot of different activities surrounding job search, understanding LinkedIn. We also have some computer programs on Word, Excel, and PowerPoint. So some really, some beginning stages, some entry-level stages into workforce and career development, where someone, and these can be utilized by anyone, they don't have to necessarily be in our program, they can come in off the street, they can use our resource room, they can look for work, they can go through a class, and a lot of times individuals will do that and then they get a job. So this is another way we're helping that community. So does anyone have any questions?
I do.
Yes.
So with a shrinking employment environment because our unemployment is so low, what happens for people coming into the workforce if there's no place for them to go in the county? So are you saying that what would work best is to also expand employment opportunities?
But there's a lot of opportunity for employment, we just don't necessarily have the bodies to fill that. So we're working at different ways of helping employers be more productive with less staff, or consider different populations for that. We've been doing a re-entry program for individuals coming through the court system, and that has actually won National Society of Human Resource Management accolades.
Okay.
And it's been duplicated it's being duplicated in other areas. So there's populations. So we're on our 13th cohort in 5 years, and we generally serve 5 to 8 in that. We work with the State Line Society of Human Resource Managers. We work with the community college. We work with vocational rehabilitation. Judge Weech, retired Judge Weech, because he wasn't retired when we started it, is a big contributor to the program. Lori Parrish, county board member before, has come in. They do work with these individuals from financial literacy to how do you interview, how do you put your resume together, what skill sets do you need. We couple that with our scholarships to training or internships, depending on their backgrounds and that, where, you know, what their skill sets are. It's been very, very successful.
Okay, thank
So
you.
we work with Parents Alliance on a project called Project Search that serves eight every year through the school year, eight young adults with developmental disabilities, and works with Northwestern Hospital in Woodstock right now. Works with vocational rehabilitation and MCC, gets them the employability skills, gets them internships in the hospital, and actually we've had like 95% success rate getting them hired into the community in unsubsidized employment. So we look at these different populations. Then with people retiring, can we job share for some of those retirees? Because sometimes they don't want to retire completely, but they don't want to work 40, 60 hours a week.
Imagine.
So can we look at that? Or can they be there 20 hours to mentor somebody else and develop those skills so that they can be super productive?
That Project Search, we had a presentation on it. Oh, it was just so inspiring. They had a video and pictures of kids who were who were learning and then got jobs, and they were just so happy and thrilled that they can contribute and have a job. It was really
We
cool.
will hold a graduation for the current cohort in May at McHenry County College in their auditorium, and we'll make sure that invites go to everybody
That's
on
great.
this committee.
That would be great.
It's a wonderful experience.
Thank you.
And I think one highlight from that program that I love is the fact that we're seeing this population also getting full-time work, which for the individuals, it's a dream for them to have that. And then they can sustain and really start developing a life of their own outside of what they know in their normal household.
I produce this quarterly, and it highlights some of the successes. We met with Senator Durbin, and he said, "Tell me a story." That's how you reach legislators, so they understand what the effect is in their communities and how it really affects their constituents. Pam has been a very big supporter of this and our programs, so I thank you there when you were in the state legislature. So thank you. In here, the first story is about Project Search. So, you know, we're very proud of the success that we've had with Project Search. So.
Any additional questions?
Great, thank
Thank
you
you
very
very
much.
much.
Hi. Is it homeless shelter challenge time?
Yes.
And I know you've been here a long time, but my intent on adding this to the agenda was really to set the table for what I hope is a good discussion next month, and a discussion that shows we're moving the ball on this subject a little bit. I have, along with Scott, had several conversations this winter with staff at the City of Woodstock, the city manager and police chief, about what they view as kind of an inordinate number of calls coming from that Super 8 hotel in Woodstock. And it kind of prompted a larger discussion with Frank Samuel and staff at the Pioneer Center about where we are on capacity at the PADS shelter. And some of you may recall, last October, we had Pioneer Center staff into the former PHS committee to talk about, you know, where they were in capacity, and at that time it was, you know, running about half, about half of the 70 beds were being taken each night, and, occasionally families would present themselves, and they were allowing that number to drift up into the low 40s, but they were hopeful that things were going to change soon. As I'm seeing CDC guidelines, and I've asked Melissa Adamson to look at those, we do see that there was some changes that were announced at the end of November that would allow more people into the shelter. I don't think we're seeing that yet. Scott and I had a phone conversation last Friday, our virtual meeting, with Frank and his staff, and they're still hovering in that 35 a night range, which you can see why the staff at the City of Woodstock are like, well, we need to open that up a little bit more, because there is concern about some of the overuse of the Super 8 and the calls that keep coming from it. Now, there's some very plausible and legitimate explanations of why there's a lot of calls to Super 8, and it's not all related to Pioneer Center. It's not all people that Pioneer Center is placing there. We were also using that shelter, or that hotel this winter, for some cold weather sheltering. I think we put 16, 18 people in there this winter on nights where the temperature gets below 15. But we need to talk about getting the shelter opened up more broadly. And I've invited Frank to be here next month to talk about what they're doing there and how the challenges they're facing, but the reality that we need to get more than 35 people in there. And I think Hans gave you some numbers here this morning.
So just for clarification, is there a limit to about 35, 40 people that they're allowing in the shelter? Or
they've kind of, I don't know what, there's 70 beds.
Right.
They've been kind of enforcing about a 35-person limit. Again, allowing that number to float up if it's family members and children.
But if somebody needs to, off the street comes in,
They don't get shelter.
It's generally not the kind of a drop-off clientele that they're having.
so, you know, I know about the cold weather
Mhm.
program, and it was interesting during, that cold snap right after Christmas, or right before Christmas, I think it was before. We were leaving Kohl's, and my daughter and I were in the car, and there was a guy standing there asking for money. It was so cold outside. And I said, do you know where to go? And he said, well, yeah. I said, well, you know the pad shelter. He's like, well, I'm waiting for 10 o'clock, so then I can go to the Super 8. So,
Well, because, so I went out to the camps, whatever you want to call them, people who live rough, who live outdoors. Pioneer has a stricter eligibility criteria for engagement in the shelter. And often what happens for people who chronically live rough, they don't meet that threshold. And so, because it's congregate, it doesn't work for people who have co-occurring mental health or substance abuse issues.
Right.
They do not embrace a harm reduction model. They don't. I know shelters are chaotic. They're chaotic. If they're not staffed up properly, so that's part of it.
We have a gap.
Yes,
We
yes.
have a good shelter. It's not being used to its full capacity. Even if it was, there still is challenges with some of that population.
They don't
and
want to
you
go in.
appropriately identified it.
And there are people absolutely
We
who
have-
don't want to go.
We have a kind of a camp here in Woodstock. There's
Yep.
another one in
Well,
Crystal
and
Lake.
so that's where Work Corps steps in, because they go to the camps. They go out there, they meet people in the snow, in the ice, and make sure there's.
So I don't want Woodstock to feel as though they are being put upon, and that this Super 8 being a depository for challenges that become the Woodstock Police's challenge. We have asked for the last 3 months of police calls from the city of Woodstock to be shared with the Pioneer Centers. It can't go the other way because there's HIPAA violations, but we'll let the Pioneer staff has welcomed this. They want to see who's associated with these police calls so they can cross-reference and all that. But it's not going to solve necessarily the gap, but it's going to, I think, more appropriately identify how we're going to move ahead next year.
Well,
Now,
if you get thrown out of the shelter for, whatever, I'm not even going to talk about it, then that's it. You can't, and you're on the street, that's it. I mean, so the shelter, Pioneer would be important for them to look at how they staff up and modify their intake eligibility. And according to HUD, adapt and modify their program.
Hans' staff is doing an audit on
Great.
February 6th through 8th.
Great.
Of what has transpired, over this winter. And that'll be a good data set for you at your next committee meeting, and I'd appreciate some of those challenging questions.
Yeah,
for
yes, thank you.
And they also have to present what their challenges are
Yep.
with regard to ensuring the safety of the people who are currently in the shelter,
And they
from
are
people
very,
that are
very-
being, you need the whole scope.
No, I don't disagree with you. However, to me, that's a training issue. I have several people that I've worked with that come out of shelters in Chicago or Rockford, and they're trained. They're trained. I mean, there's a lot of really strong safety training. To me, because either you're going to serve people that are unhoused and accept that some people will never go inside. I mean, that's a hard thing to get, that there are some people who, no matter what you do, will never go inside.
So you saw the state of Illinois and the federal government are kind of saying COVID's over soon. I'm being flip, but I think we need to get past the capacity limitations that they've kind of self-imposed. We need and they I talked with Frank again last Friday. He was going to call the state and see that they could let things come up. I said that I want him here. I think maybe it's February 28th is your next meeting. I'm not sure. It's soon, and they're going to plan on being here. But we'll have the results of the audit.
Yeah.
How much money does the county give them?
Well, we gave them a big chunk
To build.
to facilitate a 70-bed facility.
That was through ARPA, right?
So where are they getting it?
I think it was
Just a
before that.
grant.
I think it was before that. There was a transfer of mental health dollars that came from the sale of the Kishwaukee site, and we'll have Hans rebuild that for you. But I think it was before ARPA. That's all I have.
Well, I'm looking forward to that meeting.
Yeah.
Yeah. Well, I think in keeping with, the challenge in housing, Member Ness has put together some information and kind of maybe a few things that we need to continue to work on. So I'll let her tell us about that.
Thank you. So in front of you, you have it's a very brief proposal to put a work group together to begin to create an actual plan for implementing workforce housing and expanding the stock of decent workforce housing in McHenry County. When I was listening to the workforce people talk, someone who's making $15 an hour can't live in this county. They're paying 65% of their income to their rent or their housing. And I'm not even talking about childcare or
Utilities,
any
any of the
of
association.
that stuff, right? So I did some research surrounding counties, talked to communities who have done met with Kim from the Housing Authority, and I think if we could put together off this committee a working group of planners, municipal people, developers. I don't at this point want to bring social service providers to the table because we're really talking about housing. And so I've asked Pam, because I would like there to be a Republican and a Democrat that sort of co-lead this, and Pam knows everybody except God in the county, and
God and I have a working
relationship. I just want to say,
it's not always good, but it's,
and so I do really want us to start from scratch. I wanted to get some leverage. The 4 things that we would do initially is to create the working group, and I don't know if members have to be, I don't know how this works, so I'm just going to put this out there. Look at some place like Highland Park that has had some success with inclusionary programs and build some bandwidth, generate reports to this committee, and then use the data that Hans has, the stuff that he's provided. And within, I would say, 6 months, we would like to come back with something. So I don't want this working group or this task force to go on for years. And so that's as far as I got.
And I think that information ultimately at the end of whatever can also go to shared services so that this is, again, a county initiative, but is shared with our other municipal partners so that everybody understands that this is something that has far-reaching consequences lack thereof. So,
thank you for this. After the last month's meeting, we kind of noodled around this idea. We did, as staff, come up with something called a task force that kind of looks like this. So I'm pleased we're kind of going in the same direction. Scott took the first dive into it and then sat with Hans and exchanged some ideas about who might be on what he was calling a task force. We shared it with Tracy and Chairman Bueller, and I think there's some thought that looks good. We were waiting another month until we get the strategic plan a little bit closer to being ready. We're going to share some of that language with the board next month. But we're going in the same direction. I wanted it to come out as a directive out of the strategic plan, but you're
well, we talked about it
in a positive way.
We talked about it at the last meeting. So yeah.
Well, and
I'll share with you what Scott put together.
and I know that Woodstock is doing that, we talked about that integrated affordable housing for seniors from independent living to assisted living. It's gonna be off the square, it's gonna be a great project for them, and Kim was an amazing resource in our meeting from the Housing Authority. I mean, she's been around the block, around all different kinds, so I felt really like we have some stuff to work with, and Hans is amazing, so, yeah. And that, what is it called? Come on, the detached homes, what are AUDs or?
Ancillary dwellings?
Yeah, though I know it's getting significant pushback at PEG, it is part of a solution.
It is.
To this, and so that was just my thought. And then that we would come back in 6 months and say, here's what we've collected and gathered. We would want to be attached to the 2050 so that whatever we created is integrated into that. Yeah, just kidding. So now what, so do we vote on it or do we?
I don't think we need to vote. I think it's a direction, isn't it?
If there's consensus that we want to move in this direction,
Okay.
then I'd like to add a little more structure to it maybe, but I think, maybe we talk about timelines and what do we call it? And,
Yeah,
and
absolutely.
who's being on it, who's a formal member, who's a
Yeah.
contributor, and those kinds of things.
Yeah, I'm totally good. I didn't want to be real specific because I think it will organically also create itself depending on who we bring to the, so I didn't want it to be like just my thing. I want it to be everybody's initiative, and so, yeah.
So can it be an agenda item at the next?
Yeah, great.
All right.
Okay. Ooh.
Just doing that so Kathy.
Thank you.
Oh, you're
Lou,
welcome. Thank
I
you.
appreciate it. It's definitely something we'll keep working on. Okay, so I think we have a necessity for executive session. So
Motion to
anybody
adjourn?
want to message?
Got my hand on.
That's a non-verbal.
All those in favor?
Aye.
All those against?